Okay. Good evening, everybody. So today, I am going to discuss a particular case study of uh, a transverse patellar fracture. Okay. So this I have received one X-ray film of uh, from one of my junior colleague. Basically, this is that is his sister's radio that X-ray film of his sister's one patellar fracture. So I'm just going to give a very basic idea about that particular case only. So let us start. So I'll take one pen. Okay. So before starting to that, we should understand few anatomical directional terms. Okay. So during my course, my professor told always to consider the anatomical or to predict the anatomical direction. Always you should consider your face is forward and the arms are at the side, the palms are facing forward, and the feet also pointing forward. So with this consideration, we should understand, means we should predict the anatomical directional terms. Okay. So first is coming superior and inferior. So superior means it is towards head. Okay. And inferior means it is towards feet. Now you see this here, I have given one example. So this is the heart, okay, and this is your small intestine, this is your duodenum, jejunum and ileum. Okay, so this is your small intestine with that three parts. So I can tell this heart is located superior to the small intestine, because if I take small intestine as reference, so my heart is towards the head. So that's why I'm telling heart is located superior to the small intestine. And similarly, if I take heart as reference, okay, so my small intestine, it is towards the feet, that means it is inferior. So I can tell the small intestine is located inferior to the heart. Now coming the anterior and posterior. Anterior means it is to the front, as the name suggested, and your posterior means it is the back. Now you know, in our chest, just below the sternum, our heart is there. Okay, this is the sternum bone. Okay, so I can tell the sternum is anterior to the heart. It is simple. It is front of your sternum is the in front of the heart. So it is your sternum is, I can tell the sternum is anterior to the heart. Similarly, I can tell just below the sternum bone our heart is there. So I can tell the heart is posterior to the sternum. Okay. Now coming to the next term, it is called medial and lateral, and sometime this anterior is called ventral and posterior is called dorsal. Those are the all anatomical and medical terms. Okay. So now coming to medial and lateral. Medial, if you draw a midline which is dividing the body, so near to that it is called the medial area. So that medial means towards the middle of the body, and lateral is these are the lateral away from the midline, so that is the towards the side of the body. Now you can see here, this is the lung, this is the heart, and both side lung is there, so it is away from the midline, okay, but heart is in the midline, so I can tell heart lies medial to the lung, okay, because these are the lateral side and heart is in the middle, so I can tell heart lies medial to the lung, and similarly I can tell lung lies lateral to the heart. It's very simple to understand. Now coming the very simple anatomy of knee joint. So this is a film. So this bone is called femur, this is the patella, okay, this is the tibia, and this is the fibula, okay. So you can see this is your femur, this is the patella, this is your tibia, and this is the fibula, okay. Now coming to the different view of the radiological view of knee joint. So first is coming anterior posterior view. So here your leg, this is the right leg. So this film is the AP view of right leg, okay. So the radiological film is placed the posterior side of the leg, and the X-ray is exposed from the anterior side. So this view is called anterior posterior view, okay. So here you see in the AP view, this very clearly it is your femur, and this is your patella, and this is the tibia, and this is the fibula. This is very simple. All other attachments and all these things I am not going in details, because to understand that particular case study what are the things needed, I am only explaining that. Now coming to the lateral view. So see in the radiography film should be below here, this area below, okay, and your right leg should be placed like this angle around 30 degree, okay, and your X-ray will be exposed from this side. This is called the lateral view. This is the lateral view of the right leg. So similarly it is very clear, this is your femur, this is the patella, okay, and this is the tibia, and this is the fibula. Another view is there which is called sunrise view. So your leg should be folded in this way, and your radiographic film should be placed here, and X-ray should be exposed like this, okay. So now if you see, if this is a hill, so sun is getting rise from here, so it is something like sunrise view. So in that in this you see, this is basically the femur, and your patella is raising, this is the patella is raising as similar to sunrise. So this is called the sunrise view. Now we are coming to the fracture, one particular fracture. So here if you see, if there is this fracture, you know, in this way it is getting fractured. So basically it's a transverse patellar fracture, okay. So this is it is not, these two parts are not that much displaced, so you can consider it is non-displaced or minimally displaced transverse patellar fracture, okay. So in this case the patient will be able to extend the knee with full extension. Like if you sit normally, if this is a chair, you can consider if you consider this is a chair and a person is sitting, so his leg is like this, okay, this is your knee. Now if the patient is able to take the leg like this, and this full extension is possible, even though there is a such kind of fracture, so that we can consider as non-displaced or minimally displaced fracture. So in such case, the knee immobilizer or brace is sufficient to for the fixation of the fracture, okay, for the compression. We can take another picture. Here you see that the two parts are separated out. There is some significant gap. So this is called displaced transverse patellar fracture. Okay. In that case, the patient, if you sit like this, so if the leg is like this, he is not able to extend the knee with full extension. That time the surgery is required. Okay. So what is to be done? So using some reduction clamp, the reduction of fracture will be done. After that, this is a common technique. It's a very commonly used technique. So K wire, these pins are called K wire. It is very commonly used in orthopedics. This is basically, so the two pins are inserted, and this is a, you see, this is a figure 8. This is called figure 8 tension band wire is applied for compression. So from this, so far whatever we have discussed, from here we have understood that if the fracture is displaced, so that time that knee immobilizer or brace is not sufficient to do the treatment. So that time definitely you have to do surgery, and by applying the reduction clamp, you have to reduce the fracture. Okay, then you have to apply the K wire. This is the two K wire pins. Then you have to apply the figure 8 tension band wire to for the compression. Okay. So now this is the particular case. So this is a 37 years female. I think she fallen down from the staircase. So you see, this is the AP view already we have seen. So this is your femur, so this is the tibia, and this is the fibula. Okay, you can, if you see, or earlier, you see, this is the femur, so this is the tibia, and this is the fibula. Now if you see the actual, this case study, this is the femur, tibia, fibula. Okay, so here also femur, tibia, fibula, but in the patella, you see there is a big fracture, the gap is more. So this is a transverse displaced patellar fracture. So here the surgery is required. So this area, that K wire is to be applied, and from that side, that figure 8, that tension here, what you see that again. So this is the, if you see, so same way. So here you have to insert the K wires, and then that figure 8 tension band wire is to be applied. So here what I was telling. So first, like this, first using the reduction clamp, the fracture should be reduced. Then you have to apply the K wires, then the figure 8 tension band wire is to be applied for the compression. So this is the thing. So it is a very simple way. For this particular case, whatever the things required, I have explained. Okay, so hope you have understand the thing and it will be useful. So thank you so much.